Every exercise should begin with the creation of a planning team. At least one member of the planning team should have experience in designing and conducting exercises. The other members of the planning team should have sufficient breadth of expertise to be able to represent the differing departments, institutions, and/or agencies that will be asked to participate in the exercise. All planning team members should be familiar with the plan and the procedures that are going to be tested in the exercise, and at least one team member should have sufficient expert knowledge to create a realistic and plausible scenario. During the first meeting of the planning team, called the Concepts and Objectives meeting, the team must develop a clear and detailed list of objectives for the exercise so that both planners and participants understand what is to be tested during the exercise. It is commonly recommended that the objectives be SMART, that is to say, specific, measurable, achievable, realistic, task-oriented, and/or time-bound. During the Concepts and Objectives meeting, the planning team should also clearly define what is in scope and out of scope for their exercise. Planners should definitely try to avoid the temptation to try to create too many objectives for any one exercise. As a general rule of thumb, it is advisable to have between 5 and 10 objectives for an operations-based exercise. While it is understandable that planners want to get as much as they can out of their operations-based exercises, given the effort that these kinds of exercises can require, it is also unfortunately true that trying to evaluate too many things at one time means that nothing is executed or evaluated particularly well in an overburdened exercise. After the exercise planning team has agreed on the objectives and scope for the exercise, some members of the team can next create a scenario for the exercise that allows them to test their objectives. It is important that the scenario be realistic and accurate. This is both to sustain the interest and engagement of the exercise participants and also to ensure that the exercise is a true test of the plan. For this reason, it may be advisable to have infectious disease experts review any proposed scenario that tests special pathogens plans for any errors. Similarly, public health and public safety experts may be helpful in reviewing scenarios regarding any assumptions about external agencies' roles and responsibilities. Obviously, however, the exercise scenario should generally not be shared with any of the expected participants in the exercise ahead of time. There are 3 important documents that should be created in the development of an operations-based exercise. The exercise plan, or X-Plan, is a simple handbook for the exercise that provides a summary of the exercise objectives and scope of the exercise for everyone who is participating in the exercise. It provides an overview of the general schedule for the exercise day and helps to ensure that all participants clearly understand what is expected of them during the exercise. The X-Plan also contains all of the necessary information to facilitate safe conduct of the exercise, including describing the boundaries of the exercise and the procedures for emergency stopping of the exercise if required. The X-Plan does not contain any details about the exercise scenario itself. The Controller and Evaluator, or CE, handbook is a document that is specifically designed to help facilitate the smooth execution of the exercise on the day of play. It details how exercise controllers are expected to facilitate exercise play, and it also specifies how evaluators will observe and record documentation of exercise play. The Controller and Evaluator handbook does include details about the exercise scenario, since this document is not given to exercise players ahead of time. The Master Scenario Events List, sometimes called MESL, is the script of the exercise and is a chronological timeline of the planned events of the exercise. Planned events within the exercise are often called injects because they represent information that is injected into the exercise. It is important that the master scenario events list also describe the expected actions of participants in response to each inject. If this is done, the evaluators can tell whether the participants responded according to the plan or in some other way. The measle should be very detailed and should be written to ensure that there are sufficient injects and expected actions to allow the players to meet exercise objectives. Contingency injects are sometimes also included in a measle to ensure exercise play moves forward adequately, to ensure exercise play meets with the exercise objectives. The measle is obviously never shared with the exercise players before the exercise is conducted. NETEC exercise templates are available to help hospitals and others develop these exercise documents and can be found online at netec.org. Every exercise should also have a detailed evaluation plan that is designed at the beginning of the exercise planning process. Because exercises are conducted in order to evaluate whether existing plans and procedures are adequate, and also to assess whether there are any gaps in existing systems, it is essential that every exercise have sufficient numbers of evaluators to observe and document exercise play, and that the evaluators selected are given the appropriate tools to support their work. Exercise Evaluation Guides, or EEGs, are written documents that are created to help evaluators collect and interpret their relevant exercise observations. EEGs should be created for each exercise and should list the specific tasks within the plan that evaluators should expect to see participants perform during exercise play. EEGs should also give the evaluators a mechanism to record their observations and comments about how those tasks are performed. Without adequate EEGs to support an exercise, there is a significant risk that important data and observations from the exercise can be lost. NETEC exercise evaluation templates are available to help hospitals and others develop their EEGs and can be found on the NETEC website. Each exercise must have adequate numbers of evaluators who can adequately observe exercise play. If evaluators are asked to monitor too many actions at once, or if they are asked to evaluate functions in different physical areas, there is again a chance that important observations will be missed. Of special note, for some of the physical actions that are commonly tested in a full-scale exercise for Ebola or other special pathogens, it is essential that evaluators be located in positions where they can fully observe the participants' physical movements and actions. This is of special importance for those actions where contamination or infection of responders is possible, such as during direct patient care or doffing of personal protective equipment, or PPE. As part of good exercise planning, there are a number of additional considerations that, when addressed, can help operations-based exercises for special pathogens go smoothly. For functional exercises, it is very helpful to confirm all of the contact information for the participants and to verify that the systems they will be using to communicate during the exercise are functioning appropriately. If, on the day of the exercise, the functional exercise participants do not have access to accurate phone numbers, radio frequencies, email addresses, and/or login information to their relevant emergency response websites, the participants may not be able to share information with one another, and the exercise may fail. Obviously, it is an important finding if participants' communication systems are found not to be functioning appropriately before the exercise, and the cause of the malfunction should be identified and addressed. However, it is generally best not to waste leaders' time to discover these kinds of errors during an exercise if it can be avoided. For full-scale exercises, because of their complexity, there are more actions that planners may wish to consider before the day of the exercise to help things go well. If actors will be used in the exercise to simulate patients or other participants, it is essential that both the actors and the exercise players clearly understand the scope of play and safety procedures. Actors should receive instruction about their signs and symptoms of illness, and should also be given clear guidelines on what they can and cannot do and say, if anything, that deviates from the master scenario events list. The exercise players should understand the limits of what medical care and interventions they can perform for the patient, including undressing the patient, performing an exam, and performing procedures. If a mannequin or mannequins will be used in the exercise instead of actors, an exercise controller is typically assigned to the mannequin to describe the actions of the mannequin to the exercise players and to describe the mannequin's signs and symptoms of illness. Some hospitals have had success in using patient simulators during their special pathogen exercises. If a medical simulator is available to be used, it should be accompanied by a controller who is comfortable with its use. Simulators can sometimes be used instead of a live actor to test how clinical care teams perform their patient assessment skills while wearing PPE. In addition, it is possible for medical procedures to be performed on medical simulators that are not possible with the use of live actors. If simulated body fluids are to be used to test the participant's skills in cleaning the patient or cleaning up spills, it is often much easier to use these fluids with a mannequin or simulator as well, instead of with a live actor. Medical simulators do have some limitations. Some do not allow for ultrasound studies or certain types of special procedures, such as placement of central venous catheters. For specialized assessment of these skills, while the exercise players are wearing PPE for special pathogens, additional training devices or task trainer equipment may be needed in the room for the exercise. While some hospitals are able to conduct full-scale exercises in the clinical areas where care would be delivered, such as an emergency department or the intensive care unit, other hospitals are unable to do so because of the need to keep those spaces open for ongoing patient care. Hospitals in this situation should consider creating a mock-up of their clinical care space in a conference room or other similar space. This mock-up will allow them to exercise their HCID plans as accurately as possible without interfering with usual clinical care operations. To create this exercise mock-up space, hospitals could first tape the layout of the clinical care room or rooms that would be used onto the floor of the conference room in their exact dimensions. Second, hospitals could ensure that the equipment that is used for patient care in the exercise, including the stretcher, monitor, phlebotomy, and other supplies, are all identical to the equipment as it is used in the real clinical care room. Exercise players should treat the taped wall lines as real walls and adhere to the space constraints they have been given to help ensure the exercise is a realistic test. During exercises that test special pathogen capabilities, plans, and procedures, it is essential that all staff don and doff their PPE just as they would in a real-world event, and similarly, that they perform their clinical responsibilities in the appropriate PPE as well. Because it is significantly harder to perform most medical tasks while wearing PPE, and it is also harder to communicate among team members and with the patient when wearing PPE, it is very important that exercise players perform all of these essential actions in as realistic a situation as possible, including while wearing their protective clothing and respiratory protection. A master scenario events list for a special pathogens exercise may include injects where players must share information with one another and/or must communicate with others outside of the patient room in order to manage the patient effectively, and all of this should be done while wearing PPE. In order to ensure that the exercise reinforces best practices and the safest possible behaviors, it is also extremely important that all staff wearing PPE doff their PPE following the usual checklist and procedures for the hospital, and that no players skip steps in the doffing of PPE in an exercise. Because the doffing procedure is one of the higher risk situations for contamination of staff who are caring for a patient with Ebola or another special pathogen, this procedure should be very carefully observed and evaluated and exercised meticulously by the exercise participants. Additionally, because wearing PPE can create additional physical stress and fatigue for the exercise participants, all exercises should include a safety monitor who ensures the participants wearing PPE do not become excessively fatigued or overheat. Participants should be encouraged to stay hydrated, and water and snacks should be provided for all staff after they safely doff their PPE. On the day of the exercise itself, all players, controllers, evaluators, and observers should be briefed on the exercise activities, including its objective and scope, as well as schedule and rules for safe play and emergency stop if needed. It is desirable if the exercise controllers can communicate with one another during exercise play as much as possible. All exercise controllers should be always able to communicate with the lead controller throughout the play of the exercise. Following the conclusion of the exercise, hospitals should gather their exercise controllers, players, evaluators, actors, and others for an immediate discussion of the strengths and challenges observed during the exercise. This event is typically known as a hot wash, and it serves as a forum for everyone to share their experiences while the memories of those experiences are still fresh. The hot wash is typically moderated by a member of the exercise planning team, and the comments made during the hot wash are recorded for inclusion in the after-action report. Every exercise should result in an after-action report and an improvement plan. The after-action report is a detailed document that is built on all of the data collected during exercise play, including players' observations and the evaluator's notes, as well as exercise evaluation guide documentation. The after-action report should be organized according to the objectives of the exercise and the capabilities tested. Changes to the plan, procedures, or system that are requested in the after-action report should be cataloged in a document called an improvement plan. The improvement plan lists all of the changes that are expected to follow conduct of the exercise and also lists who is responsible for making each change requested. By tracking the items on the improvement plan to completion, hospitals and communities can ensure that their preparedness and response for Ebola or other special pathogens will improve with each successive exercise that they conduct. We wish to thank you for taking this course, and we hope that it has been helpful to you as you prepare to evaluate and improve your plans and systems to provide care to patients who may be infected with Ebola or other special pathogens. We are all aware that we must test our plans before they are used in the real world. None of us wants to be asked to care for a patient with a potentially concerning disease before we have had a chance to see how effective our existing plans and systems actually are. We hope that this course and the NETEC tools that are available will help you to design and conduct realistic tests of your plans, and that these tests will help you identify ways to improve your individual plans before they must be used. We also hope that these resources will make the process less cumbersome to you, as we understand how many demands there are on everyone's time. Please do visit the NETEC website to find resources that will help you in your exercise planning and conduct. Please also feel free to reach out to us at the contact address here for any suggestions or questions that you may have.